on the major role of religious institutions and leaders in Indonesia and the United States in moderating the coronavirus pandemic. How can positive roles be enhanced and negative ones reduced? Of course, a great proportion of the world's population is accustomed to turn to religious leaders for guidance in times of crisis. But the converse, the strategic role of religious institutions and the role they can play in development, and particularly in health, is far less understood. Many of Indonesia's religious institutions have been delivering beneficial health and nutrition information to their members for decades with proven results for health. Indonesia is a leader in that field. They and their US counterparts are now in a position to contribute powerfully to resolving the most massive health crisis of the past century. Today's program will explore and compare the recent actions taken by religious institutions and leaders in both countries, examine the effects they have on coronavirus response, and identify opportunities to enhance the beneficial role religious institutions can play. In recent weeks, Indonesia has made its key decisions to align with religious institutions for disseminating useful information to the public for curbing the coronavirus, furthering public acceptance. President Jokowi has banned the practice of mudik, the exodus to villages by millions of Indonesians during Ramadan. Indonesia's two largest Islamic organizations, Muhammadiyah and NU, urge followers to skip mudik this year. The Indonesian Ulama Council, MUI, issued a fatwa advising Muslims to curtail communal activities, use virtual technology, and practice social distancing. Indonesian Christian organizations have urged similar practices. In the US, there has been similar guidance issued by religious leaders, including Muslims, Christians, and the Jewish community. The response has been positive overall, though with some important exceptions. But it's clear that understanding and fully utilizing the role religious institutions can play in this crisis is a key element of flattening the curve and moderating the spread for everyone.
We're actually seeing more and more efforts by religious institutions to dispel with lots of efforts, such as issuing guidance and helping with the delivery of foods for the needy and people who are impacted by the COVID-19. And also we're seeing religious leaders working closely with government to make sure that many messages concerning the social distancing and also the need to practice safe hygienic lifestyle using religious idioms. So on one hand, of course, this is a very difficult situation for Indonesian Muslims, given the fact that this is Ramadan, and also the American Muslims, of course, given that this is Ramadan, and during Ramadan, there are many rituals that are usually practiced collectively, going to the mosque together, the tarawih, the itikaf, and staying at the mosque, praying at the mosque. And like you mentioned, David, we've got the mudik as well. This is like the Thanksgiving in the United States, where families go home to spend some time with their loved ones. So these are all the challenges that we're facing, and efforts from the government as well as from the society and the private sectors to come together to make sure that there are concerted efforts. There are community approaches that are taken to combat these diseases. And this is where the religious organizations come into play. Clerics, of course, have more effective approach when it comes to dispensing with with messages that are believed by the congregations, using religious idioms, using religious narratives can be quite effective in getting people to understand different perspectives about these conflicts. And of course, the challenge remains that there are some groups who are taking a more of a simplistic and also fatalistic approach when it comes to religion, saying that what happens is the will of God. Therefore, if you you should not fear the virus more than you fear God. There are rhetorics like that also circulating, and this is an instance in which the wisdom that comes from the more progressive religious leader are needed so much more in this in this time of a crisis. So we are seeing, of course, conflict of narratives happening, but we're also seeing quite interesting phenomena, which is that there's a convergence of rhetorics as well. So before, Indonesia was somewhat divided by a different religious, I suppose, different approaches to religious lines, the so-called the progressive and the conservatives, as well as the radicals. But now you're seeing more and more rhetorics that are in convergence with one another. You're seeing groups that are considered quite radicals, but issuing guidelines that obligating their followers to stay home. You're seeing also groups that were seen as being more progressive before, but are taking a much more conservative approach, and in fact challenging governments for not allowing them to pray in mosque or in other religious buildings. So it's very interesting phenomena that we're seeing now. But I think all in all, religious institutions needs to be included in the whole efforts to combat the virus, because of the influence that they have, because of the networks that they have down to the village level, and the sheer numbers of memberships that they have that will enable them to reach out to communities much more effectively than government officials.
We know from history that pandemics almost always mark enormous changes in life, in society, in philosophy, in thinking. And we do have now two narratives. One narrative, the positive one, is that people will, as Yenny was suggesting, realize that there's a common purpose, a common enemy, that we will see a breakdown in tensions and coming together. But the other narrative, which unfortunately is the historic one, is that it will aggravate tensions, that people will look for scapegoats, that they will find enemies even where they don't exist, that conflicts that are already underway will be exacerbated. And of course, this is up to us to decide which of the narratives is correct, to start thinking now about the kind of future we would like to have. As someone said, you should never waste a crisis. We should be looking with imagination, with energy, with participation, but also with rigor, intellectual rigor, to what this means for climate change. What does it mean for children, for education? What are we learning, and how can we, in fact, truly build back better?
The efforts of Muslim organizations has been very supportive to not only for government but also for the community as a whole. In general, it is difficult for us to imagine that Indonesia without this Muslim organization, without activities, without program of this organization. They give not only religious guidance, but also they are very active in, as I said earlier, collecting donation, collecting alms giving, from the rich and then distributed to the poor, because actually, there has been a lot of criticism to government, which is very slow in giving some necessary help for the poor, for the weak.
Of Churches Indonesia immediately established what we call the Church Combat COVID-19. And since the beginning, the Communion of Churches had collaborated with a Muslim organization, Duafa, to especially to train the volunteers from the young people from different church denominations, especially for spraying disinfectants in buildings and facilities of the church, mosques, and schools. So it is realized that COVID-19 is not only a health issue, but has a significant impact on social and economic life of the people. Many people lost their jobs. Many people frustrated for long-term staying at home. And many people also facing, I think, some difficulties in dealing with this issue. And therefore, the pastoral and diaconal ministries of the churches is become very important to express the solidarity with all people and provide support for people in need, regardless of their social, cultural, and religious backgrounds. Also, the churches, the Communion of Churches in Indonesia encouraged the church, in anticipation of the possible prolonged impacts of COVID. The church called the attention of the people for the importance of establishing the food security for the community.
One issue of handling the travel of the unemployment workers to their cities is one big issue. So it is not possible actually for only the governments to do that. So the social modality and also the good relationship between the states and the civil society organization is actually a strong support in the time of the crisis. And this is because once the major and the mainstream religious organization is always neutral in politics. This is actually also the modality that we have in Indonesia, so that there is no such a political interest in the relationship between the state and their social organization, and it's helped a lot in this time of crisis.
We made a decision in our area here that we will not make any religious decision without the healthcare officials telling us what to do. And based on the governor of Virginia telling us that the gathering of 10 people will not be allowed because of the spread of this COVID-19, the night before, Friday, which is Thursday night, I made a decision by gathering the imams in the metropolitan area, about 28 of them. And I told them that we would like to close the mosque. And we had a discussions, I had medical doctor on the call, and then we closed all the mosque next day. And now being the mosque completely closed, and we don't have any daily prayers or Friday prayers or wedding or any funeral being held inside the mosque. The decision being made, based on the understanding from Islamic law that we have to ask the people of expertise in those issues. And the people of expertise are the people in medical field. Therefore, we as a religious leader have to respond to the people of expertise. and that is answering the questions of relationship between religion and science. And the trust has to be built there between the religious community and the healthcare industry, our providers, or authority, by saying that we're going to defer all decision regarding health to health authority. And then we respond as religious leaders to that.